May is Mental Health Awareness Month, and joining me from Dayton Behavioral Care is Dr. Otto Dueno. Now, Doctor, thanks so much for joining us this afternoon. There are one of our partners for our Mental Health Monday, and thanks for joining us tonight. Now, what kinds of work do you do at Dayton Behavioral Care?
So Dayton Behavioral Care is a psychiatry practice, and we provide mental health services for mood disorders.
Now, how does your work bring new mental health treatments to the area?
We specialize in treatment-resistant depression, which is defined as depression, patients with depression that have failed 2 antidepressant trials, and we offer specific specialized treatments for this, for depression.
Now, I understand there's a Spravato. How does that help, and exactly what is it?
So Spravato actually is intranasal ketamine. Is a treatment program that is for patients who have not been able to defeat their symptoms of depression, and is provided in our outpatient clinic.
And just to piggyback on it, what about TMS? What is that? What does that stand for, and what is that?
TMS is transcranial magnetic stimulation. It's actually a non-pharmacological treatment. It's magnetic pulsations provided as an outpatient in our office protocol. It's a protocol that we do for the treatment of depression. It's been around for 20 years, but we were the first ones to bring it here to Dayton 5 years ago.
What kind of success has that had?
It has tremendous success. The response rate on TMS is around the 80% or higher.
Wow.
And in our Spravato, it has been also above the 60%.
So that gives people great hope, because we hear about mental health now, maybe more than ever before, and it's taken a lot more serious. Do you believe that? Do you see that in your field, that it's seen a little differently today than maybe years ago?
Absolutely. The field has been advancing, and we are now being able to provide newer treatments and programs that were not available a few years ago, and we are actually at the tip of the spear trying to provide the newest treatments available.
Well, these treatments are exciting. You talk about the success rate, but how would someone know if those treatments are right for them?
Well, they can call us and they can ask us for a consultation, and then we can determine whether these treatments are available and they can be of benefit to them.
You know, we always talk about people often don't really know if they have a mental health crisis or so forth. What would prompt someone to make that call?
Well, if you're suffering from symptoms of sadness, depressed mood, insomnia, difficulty with concentration, attention, poor appetite, and struggling also with thoughts of suicide, it's imperative that you reach out to a mental health provider or primary care physician, anyone, to discuss about these symptoms and whether it's appropriate for you to be evaluated and in treatment. And
that first step can be a big step, just making a call.
Absolutely. We have been struggling for several years now with worsening depressions in the population. In Ohio, we have seen that has been suicidal attempts and completed suicide have increased in 30% over the past 20 years. So it's important to be aware that people struggle.
All right, thank you very much, Dr. Otto Dueno from the Dayton Behavioral Care. We appreciate your time this afternoon.
Thank you very much.